series, In the Weeds, a candid conversation about the challenges, conditions, and considerations of transportation service coordination. My name is Mike Foley. I'm the Assistant Director here at the Missouri Public Transit Association. MPTA provider members provide more than 42 million rides almost everywhere for everybody every day in Missouri. And we employ thousands in our communities. I would like to welcome the MPTA board members who are joining us via Zoom this morning. Thank you for attending. Today we have an opportunity to hear from local and national experts on the topic of transportation service coordination. We have with us today 4 individuals who can shed some light on the transportation coordination and hopefully help us all learn better ways to connect transit to mobility management and navigate those challenges. Welcome to Anjali Dixon, Project Associate with the National Center for Mobility Management at Easter Seals. Mike Spatafor, Director of Mobility Management at the Jayhawk Area Agency on Aging. Chad Egan, Executive Director of Boone Select Regional Planning Commission, and Andy Frye, Director of Planning for Topeka Metro. Please place your questions in the Q&A or chat below, and we'll be monitoring those throughout the session. Anjali, if you'd like to go ahead and start us off.
Sure, I'm going to go ahead and share my screen here, and then also for bandwidth, I'm going to cut off my camera here just for a second. If you can let me know or give me a thumbs up if you can see my screen here. Are you able to see it?
Yeah, it looks good. Thank you so much.
Okay, great. Well, good morning, everyone. I don't know about where you're at, but it's definitely cold this morning. So I hope everyone's warmed up and ready for the presentation. Today's presentation, we've titled it In the Weeds, a candid conversation about challenges, conditions, and considerations of transportation service coordination. Michael has already stated who will be speaking. So Mike Spatafor, Chad Egan, Andy Frye, and I. And we'll go over the presentations, discussions and questions, final thoughts, and then additional resources that will be posted on the MPTA site at a later time so that you can always access it. Again, I'm with the National Center for Mobility Management, Easter Seals. I am the regional liaison corresponding to regions 4 and 7 for FTA. And so if there's anyone else outside of Missouri on here, these are my areas. However, we can certainly help out anywhere. And so today I'm going to talk a little bit about the National Center for Mobility Management and what we do and how we are able to support any of your initiatives and coordination among the state of Missouri. We provide national technical assistance. We are funded through an agreement with FTA. And there's a consortium of 3 organizations, which is not only us, but also includes CCAM and American Public Transit Association. Our sole mission is to promote customer service centered around mobility strategies that support economic development in your community, good health, and just making sure that there is a true partnership in the communities and making sure that there's coordination among all as far as mobility. So we always use the example that there may be 3 buses going to the same place. However, we do believe that if you can coordinate that better, and as I'll talk about a little bit later, also coordinate in the sharing funding, then we're able to maximize that service and the funding opportunities. How you can access our resources at National Center for Mobility Management here, we have a lot of products and tools. So if you need training for your mobility managers, for drivers, for all sorts of things, we have tools and products already available. You do not have to reinvent the wheel. We want you to check out our blogs, and I have sent out an email regarding a site that we manage with various discussions and blog topics, mobility management connections, and I will also send that out again to everyone. I encourage you to participate in our events and also take advantage of some of the grant programs that we have posted periodically. We certainly usually send out a blast to let you all know that those are opportunities sometimes for pilot programs or do further research within your organization, which allows you to connect a lot better in your area. So mobility management, what is it? Well, you're creating connections in your community, making sure that those connections are diverse and that they're inclusive, and it definitely is all about the customer, which is your rider and your end client. We want to make sure that all the networks work together. We've seen a lot of, we have our network here, they have their network there, but we want to go to more of a statewide network. And even as we see in Missouri and Kansas crossing the state lines, which is happening in the Kansas City region. Unfortunately, they were not able to make it to present on this discussion this morning. However, looking at their regional system, which has kind of been a model for everyone, they are now crossing over, not only just a little bit over the border in Kansas side, you know, I want to say like 5 or 10 miles over, but even to the middle of Kansas, which has been really, really great and exciting. So I'm excited to see the new initiatives they have that are on board for that. I want to make sure that you do what is best for the community. The focus has a lot of times been to make money. We have to charge a fare, what's best for the agencies or for the organization. But especially in our challenging times, we want to make sure that we look at what is best for the community and how we meet their needs. So mobility managers. I've gotten this question a whole lot in just a month and a half I've been here, is that we kind of don't have all the components and all the tools. What exactly do we need to be doing? And we definitely have those tools to help you with that. First and foremost, you need to understand what the available funding sources are. You need to know how to use them, how to maximize them, how to coordinate with other funding sources available, which is what other organizations have. CCAM, I'll talk a little bit about all of the partnerships that they have, and there's a list on their site, which will help mobility managers see how they can coordinate their various organizations in their communities and kind of link them together. And then we'll talk about the federal fund braiding a little bit. Also developing networks and relationships with partners that you don't normally think of to share costs. So CCAM, they support and recommend policies and implement activities to improve the availability, accessibility, and efficiency of transportation. Their main targets, as you'll see here, is those with disabilities, older adults, those that are lower income in those communities. They were established in 2004, and you all can already know the history behind them and how they're set up, but they are set up with all of these organizations here, all the way from VA, USDA, HUD. And so these are organizations a lot of times, even on a local level, that a lot of mobility managers are just, even the DOT themselves do not actually think about partnering with initially. So this slide right here will kind of tell you a little bit about the inventory that they have. They have 130 federal programs that provide the funding for the various human service transportation. And so you'll see all of the data here and who exactly funds. Again, we have the DOT, we have HUD, health services, all the way down to VA. And we'll talk about the federal fund braiding guide. So initially what this just says is that you're able to use federal funds from one grant program, and you're able to use that as a local match requirement for another federal grant program. And so this was absolutely wonderful, because we know that there has been a huge challenge, and that's a discussion that we're having daily of how can we match funds? We don't have the match money. How can we do this? And so that makes it very, very hard to have a coordinated system or have any type of mobility options at all in various communities. And so what is cost sharing and when does it occur? Well, we know that it's when multiple agencies work together or organizations. And so they're able to save and they're able to maximize the service in the area. When there's the same rides going the same places and you have 2 on this bus and 2 on the next bus, that's a waste of money and really a waste of time and services. So we want to make sure that we are partnering and we're sharing as much as possible in order to maximize those. Those partners normally would have an agreement, and they pay their equal shares in order to make sure that, of course, it's fair on both parties and that they're able to provide the most mobility in those areas. A couple other important tools here. We don't want to duplicate services, as I keep saying, are overlapping. We want to reduce those gaps, more service, make sure it's cost savings, and make sure that it's safe and it's reliable. One case study here is Door County, Wisconsin. They have a great model of cost sharing and sharing their vehicles here. And if you want to see more on our site, we have a whole list of various states. Well, we have all 50 states and we have their state of the state reports. And then we have, when you go on our site, you can click on there and it will give you a lot of these models and a lot of these case studies that you can look into in more detail and share with your various teams, organizations. But their DoorTrans Veteran Volunteer Transportation Program was great. It's a partnership that they have with the Veteran Services Office and Door County. Their main focus was to make sure they're sharing vehicles and that they are saving money. And so their funding happened to be redirected here through their specialized transportation assistance program. They wanted to make sure they were supplying their vehicles. They made sure that they built partnerships among these organizations here. And so I know that not every community has these specific organizations, but you know, whoever that you have here that does provide service that you can partner. They offer the following programs through a voucher program. They were half price vouchers. They also partnered with local taxi providers. And I know in some communities, for example, even here, we don't have taxi service anywhere. We don't have regular taxi service, but some still do. So that's a great partner that a lot of cities or just smaller communities don't really think about. And then the funds were also supported, of course, through 5310 and other grants. In conclusion for this program, you know, they took the time to think out of the box. And a lot of times that's just what it takes is to step out of the box, crossing those lines and digging in and brainstorming with the other organizations. They made sure that they built partnerships on all levels and that they really understood of what the resources were out there that were available to them and making sure that they kept the client and the end customer was the main focus. If you want a little bit more information and a more detailed guide on cost sharing and cross partnerships and funding models, we have a handy guide right here on our site, and that will be posted afterwards for you all to access later. And we also have a list of all of our partners that you can reach out to if you need any tools to help you out. And that will conclude my presentation.
Thanks, Anjali. And I believe, are we going to hear next from Mike from Jayhawk Area Agency on Aging?
Great, thanks, Michael. Let me do a quick screen share as well. So here we go. Are you guys seeing the screen? Can somebody just give me a yes?
Yes. Mike, we see your PowerPoint presentation, but it's not in presenter mode. I don't know if that is something you're interested in.
Sure, let me just jump back out. Sorry, this was a problem for me yesterday too.
All right, it looks like you did hit play for the slideshow. I think you'll just need to go up to maybe stop share and reshare and see if it'll give you an option for that.
Okay.
That window. There we go. Perfect.
Yay. I'll learn eventually. It's only been 2 years.
Great work. We're making progress. Thank you so much.
So sorry about that, guys. I'm Mike Spatafor. I'm a mobility manager here in Topeka, Kansas. And today I'm going to be talking to you about being a good gardener and how time spent in the weeds can lead to a massive harvest. So the problem statement that I'm going to be presenting about today is that the cost of a ride to dialysis is too damn high. This was something that came up about a year or so ago, and totally a chance encounter started this discussion. So this is a fun little ride to take with me. The solution was to collaborate with your friendly neighborhood mobility manager, which everybody loves doing, and it's the first thing people think of when they have issues with transportation and mobility. So how it started was a rep from the American Cancer Society and I were both at a totally separate KDOT meeting. We talked afterwards, and she asked if we could work on a problem that they're running into. They're providing a grant for transportation to Topeka medical centers, but something's just not going right. So I was like, absolutely, let's figure it out. So the situation is that the ACS awarded 10 grand to cover transportation trips for rural patients going to dialysis in Topeka, which is Shawnee County on the map. Medical centers then, as was their procedure, called the local NEMT provider in Topeka to schedule rides for the patients back and forth. Seems pretty straightforward, but then the bills came in. And here is a chart I put together for the costs of what it takes to get an NEMT trip here in Kansas. I'd like you to notice that there are different prices for weekdays, weekends, after hours, and holidays. So I'm going to be using a base case for the weekdays, since that's when most trips would happen for a dialysis appointment. So the $45 base rate is a person that's using a wheelchair, $380 for transportation. That's 38 miles from Osage City to Topeka, and then round trip, and then a $90 wait time fee. So assume an appointment takes an hour and you have to get into the office and out of the doctor's office, etc. So we're going with an hour and a half. So the trip through the local NEMT provider for one appointment is $515. Which if you do quick math, you know will eat away at 10 grand pretty quickly. But not only were the costs of the rides high, but each passenger had to make that trip 3 times a week. So that comes out to about $1,500 per patient per week. There had to be a better way. And you know that there was. So let's just get into it. We worked with the 5310 rural providers, who were amazing. I contacted Osage County General Public Transportation, and they work just south of Topeka. Since the patient that I was calling about was a resident of Osage City, they were happy to help. They already made trips to Topeka, so no big deal for them. And they had the availability on their manifest, so they said, no problem. And so I went over the cost of the NEMT trip with their dispatcher, and I was like, I'm really hoping we can get something lower than the $515 that we're getting through the NEMT. And she was quiet on the phone for a bit, and then she's like, no, that's ridiculous. She said they can do it for a donation recommended of $10 round trip. I'm sorry, some of you didn't catch that. $10. So cost through the rural 5310 providers, $10. Cost through the traditional NEMT provider, $515. Gives us a cost savings of $500 per trip. And that's fantastic. And that's exactly where we wanted to be going. But to get there, we had to get way down in the weeds to make it happen. So we had to go through things like getting the right people together to have meetings to understand and discuss the problem. We had to have some knowledge of the medical services being provided. We had to know the restrictions on the funding and what transportation options are available. We had to get local buy-in from the transit providers. We were going to ask them to step up, and we're in COVID, so a lot of them either reduced service or closed shop for a portion of the COVID period. Luckily, most of them are open again. This is going back about a year. We included the local NEMT provider. We needed to get their rates, and so we had discussions with them. We had collaborations at the local and regional scale, which is, I don't know about your states, but there are issues with funding being tied to service provision within county boundaries. So if County X is funding you, County X wants you to provide service in County X only. So that's something we're working through and have been working on for the past few years. We also had sharing resources. The discharge workers needed to know how to put the calls into those Collier County agencies. And until now, they've been using the NEMT local service. So this was a slight change in their policies. And then we had to put together a short training for them to implement the solution. Now, what we actually did in the grand scheme of things is we changed the phone number that the discharge planners called. That's a very 30,000 foot look at what happened. But again, this all happened in the weeds, and it would not have happened if we didn't get down into the weeds. So some of the collaborations that grew out of this process, many more riders will be served by the ACS grant at $10 instead of $515. The clinical staff at both locations now know more about the transit options that are available in their communities. More appointments will be kept, especially considering those who were paying for transportation out of pocket. And that would save on overall health costs as well. As we all know, appointments that are kept tend to result in better health outcomes. And also project funding. It was not only stretched further, but the American Cancer Society saw the good that this would do, and so they doubled the funding for the program, which was phenomenal. So that's what I have, and look forward to your questions later on.
Thanks, Mike. Really appreciate it. That's really a lot of innovative ideas coming out of Kansas there in Topeka. I look forward to seeing some of the questions as they come through in the Q&A in the chat. I think next we have Chad Egan with Boone Slick Regional Planning Commission. Chad, if you're on.
I'm on. Hear me okay?
Yes, we can.
Okay, I'll share my screen.
Great.
And then I'll turn off my camera as well to save on some of the bandwidth there. Everybody see that okay?
Yes, we can.
Okay, thank you. Oop. All right, my name is Chad Egan, and just to clarify things for mobility management in Missouri, I am the director for Boone Slick Regional Planning Commission. Kathy is joining us as well, and she is the mobility manager. Mo Rides is one of the programs that we operate, and it is transportation coordination. We cover all the counties in the state of Missouri, and we do work with the providers and other state departments. for this coordination. And so the impetus behind Mo Rides started as a feasibility study in 2013, where we kept seeing gaps either in service providers and counties, lack of communication, obviously lack of funding, which is obvious for many people because the affordability factor was not there. Started with an FTA grant, and that was also subsidized with some local match. And I know that Anjali mentioned that too. Local match is always a challenge for programs. Federal money does exist, but that local match could be the difference between actually initiating the program or not. So Mo Rides, simply enough, is there to connect individuals with their transportation providers. We give them affordable options. In the past, when we started, there was no website. So there is a website, there is email, there is a toll-free number. And I know many people today, younger ages, middle ages, don't even think about a toll-free number. But a lot of the individuals we serve are older adults, and some of them have landlines. And so we want everyone to know that the number that's on the screen there, the 844 number, is toll-free. I know in today's world, cell phones takes away a lot of the long distance charges, but if you do know someone, and typically it's the grandparents of someone else that has the need, or the disabled, the two groups that we really look for targeting, there is a landline, free call right there on the screen, otherwise email. We're happy to help and assist with individuals. The other thing that we do at Mo Rides is we want to partner with those organizations, those community groups, living establishments for older adults, state departments, all those who have transportation funding or transportation options or the need to coordinate transportation. We want everybody talking and working together. And, just like anything else, there are a lot of silos in the world that we live in. And so a lot of people don't know what others are doing. So I know in the evolution that we've had with Mo Rides since 2013, we have started to connect a lot of those dots and to really talk to people about sharing or the big transit or deviating from their fixed route, if that's possible, to pick up a few additional passengers and to help fill some of those needs. So our website, morides.org, I've got a picture of the map on the next slide, but it lists the providers in each county of the state. And that is whether or not they are public transit, if they're private, if they're individuals. Some of them are for airplanes service. You've heard about the Cancer Society. There are needs to fly people out of Missouri to other states. One of them is Texas, MD Anderson, for cancer treatments. And so we list all of those on the website. We've got the public transit ones first, and the other ones are in alphabetical order. We've also considered maybe a rating service that goes with them so that people know when they look at the website, some of the experiences that other people have had. We try to give people 3 options whenever they call, and not just one. But we do have a lot of that institutional knowledge where we've talked to other people and know some of the issues that they have to deal with. So this is the simple form that you'll look at for transportation. If you want to do a search, just put in your county. I'll show you on this next slide. If you see the state there on the right of the screen, all you have to do is move your cursor to the county that you live in, and it will populate that list of providers in the county. So the example then, the first one that we have there is on the left of the screen. That's Franklin County, just outside of St. Charles and St. Louis, Missouri, on the eastern side of the state. That's aging ahead, and it just shows you an example. It gives their phone number, their website, location, email, accessibility features, and all the information's there. We do go through, I have a staff there with Kathy that updates that. So it's very important to us to not only provide information, but provide the right information. This is just a quick snapshot of 2021. These are new calls for transportation assistance on this flyer. And it may seem like a smaller number if you look at it at first, but these are all new calls. So people that have used our service typically don't have to call back because we've shown them how to do things on their own. If they do call back, it is for some other assistance or a new issue that has come up. But you can also see then the website hits 38,000 visits in the year. And those weren't just initial search, hey, what's Mo Rides? But they actually spent some time on the website. So we really value that website, and that has been integral in the coordination effort to list those transportation providers, because sometimes people aren't looking necessarily from 8 to 5. There are different shifts for work, or they only do it on the weekends. So there's a spotlight there for Jeff Tran. We did a special project with them. I'll mention that later. But the calls for county there, you see 1 in 5 calls for us comes from St. Charles County. Most people would not consider that a county that's in the top number of calls for us, because St. Charles is affluent and they don't think that they have needs, but they really do. And we've really seen the gaps in transportation, the elderly, the disabled, the low income in those type of counties as well. Plus they have a lot of facilities that individuals will want to go to. So I will keep moving along here, and obviously any questions you have, take those at the end. But the transportation coordination, we really appreciate, and we find a lot of success, and we take a lot of value in having multiple groups work together to collaborate. And I know that Anjali hit on this with the National Center for Mobility Management. We really like the grassroots approach to getting out and talking to people and listening to them, being compassionate, having empathy, and then helping them to line up with the entities and needs that they have. In the communities, this is more than just going to the doctor. Mobility management is having that lifestyle and not having transportation as a barrier, whether it be access or cost. So communication obviously is the key. We have that information. We want to share that information. We want groups to work together. We coordinate so that we don't have 5 buses showing up to the same place and one person gets on each bus. The collaboration side of that, we have evolved again, where we're looking at a task force in the state of Missouri to really drill down into the specific transportation needs with subcommittees that we're going to outline in the coming months for those individual tasks. We've had van pools that have come up here lately, but we still have a need for individuals and more frequency of transit options and trips to their areas, especially in the rural areas, going into the urban areas. The benefits of coordination, obviously this is a federal grant program and we do want to fulfill our compliance requirements, but we have also seen the value of that improvement of mobility in a community. When people know that they can still live in their small town or the town they grew up in and be able to connect with the world and connect to the services that they need, or to have an option to go shopping for leisure activities, or even for work, for employment. So we really look at the inefficiencies that individual areas have, and it's case by case, and then look to our network as a regional planning commission with our other government entities. But also we go out and we talk to people, and we have those speaking engagements with even individual groups that have those needs. This has led to more consolidation and more people on the same bus, if you will, and also obviously then a reduction in the cost for transportation. So some of our case studies, just to quickly go over, I mentioned Jeff Tran. We've helped them solidify their Google database so that the routes that you see on their website and the live locations for their buses is all driven by a background database that lists those bus stops and locations basically with their geo code and their geolocation. And so that was a really good project. And also we helped Jeff Tran with community outreach. This was during the COVID times when people didn't think transit was necessarily safe to use. So we had a radio campaign that also went on there and have several ads that were put out that we will be adding to our website as well for a snapshot of that case study. The link is something that we helped coordinate in the early 2000s with OATS, which is one of our transportation providers in many counties in the state, almost 100 counties in the state. And that allowed people to come to the more urban areas of the county for employment, is how it started out, but they have regular routes then on a daily basis. And the latest one, other than Jeff Tran, has been Tri-County, and that is at the Lake of the Ozarks, a populated area on certain weekends and certain days during the week, but a very rural area on the outer limits that needed a lot of coordination. And they've seen ridership go up because of that project, and also an increase in their sales tax revenue because they could get more people to the businesses. That will end my presentation for now. Happy to answer questions at the end. This is Mo Rides. We are there in the office Monday through Friday. There's always someone there. And we do have the website. I mentioned morides.org and the toll-free number if you need to get a hold of us.
Thanks, Chad. And I will add
Sure.
that I've been to Mo Ride's website a number of times because here at MPTA, we get the occasional call from an individual who's looking for resources in different counties, and I either direct them to your website or sometimes we'll just look it up for them if it's a fairly quick question. So,
Sure.
And I think next we have Andy Frye, Director of Planning for Topeka Metro.
Hello, everybody. I'm going to get my screen share going here real quick. I'm going to take a slightly different approach to coordination and be talking about coordination of bus stops. And if you guys can just give me a quick yes that you can see my screen.
Yes.
Yes, we can see it.
Cool, awesome. All right, so as I said, I'm the Director of Planning with Topeka Metro, and I was going to be going over kind of a high level of the process we've gone through to try to make our bus stops more accessible to those with more individual mobility needs and challenges, as well as the general public. In terms of, in many cases in our community, we still have areas that don't have sidewalks even connecting to our bus stops. We have 12 different routes with around 600 bus stops across our community. And so that's a definite need in terms of making sure transit's accessible to all our potential users. There we go. So I'm just going to go over some different processes and kind of checklists we put in place to make that a little simpler. I think the high level message here is just that, you know, we are a smaller urban and don't have tons of resources, like I'm sure many different agencies are kind of in that position. And so we had to have some structure and some process in order to try to make this program work. At this moment, we have improved to roughly, I think it's somewhere in the 55%. So, you know, around 300 stops with at least a minimal of what we would call a standing pad, like you see there in the right-hand corner. And just providing an access point that's a hard, flat surface and allows for a mobility device to get turned around or get realigned with the sidewalk once they get off the bus. So our goals, and the reason we initially approached this was that our board had opted to make a goal to have all bus stops ADA accessible in 2015. And so we had also, and so just following that goal, the board also then established fixed bus stops. Prior to that, we'd been a flag down bus system where folks could catch the bus at any point along our route by just standing next to the road. And so in an effort to make it more efficient, kind of similar to what the other folks are talking about, not having folks stopping at every last crossroads, we went ahead and established bus stops. And yeah, as I mentioned earlier, we needed a little bit of structure in order to try and make improvements in a meaningful way. I won't go through and read through all these things, but I've listed and these slides will be available later, but we kind of established a process of review between ourselves and our city traffic engineer, and then our FDA contacts as it related to environmental review, and kind of had that down to somewhat of a science for different, what we called phases of bus stops. And yeah, as we worked through that, there was iterative improvements and changes to the designs or to the connections, whether it was sidewalk connections or, you know, interacting with different utilities and different other players in the right-of-way space. This example here in terms of accessibility was a particularly exciting one because the adjacent property owner had one of the occupants of the building was a kind of a mobility rights advocacy group that works at the State House. And so they were coincidentally also working with the city on improving their accessible parking directly adjacent to our bus stop. And so it was a great opportunity at, you know, coordinating on a level that was a positive impact for all, I think. We had a shelter there, and yeah, it was just a rewarding time to get that put in. They also brought the curb out, so it made kind of calm traffic to a certain extent, at least on that side of the street. So in this process, we also used some different planning tools. I just mentioned a couple of them as far as just kind of maintaining where we were in managing the process, as well as trying to find the bus stops that would be the most advantageous, earliest, kind of prioritizing and triaging which bus stops. So we also used, we had a planning tool called Remix, where we would help kind of isolate with some data from the city where there was existing sidewalks and the like, and kind of where there was the highest need soonest, or where we could most quickly make the most impact. That's kind of a double-edged sword though, because obviously you don't want to only improve areas that already have sidewalks, because then you kind of leave other neighborhoods or other communities out over and over again. So at a certain point, we did specifically address the sidewalk limitations in a grant in partnership with the city, with KDOT, and so that we put in, or we have funds to put in sidewalks that are around, I think it was 30 different sites that will connect the bus stops that will then develop at the same time. As far as kind of going back to our planning process, we developed kind of what we called concept papers that kind of helped us internally review what the site was and kind of have a review plan, review process between different players within our agency, obviously our operations and representing the operators and the folks out on the street every day, giving input on what would and wouldn't work in moving the buses, as well as the facilities folks are going to have to maintain it, and then myself and planning, and then you know, several other admin staff. And so with that review process, we would kind of hone in on where we thought it could be best located, what we thought would work. We had different thresholds of when we would put in certain types of amenities, whether it be a standing pad, a bench, or the third level being a shelter, based on ridership, kind of generic ridership numbers that we had. Things that we'd include on here, just so it's kind of a quick glance, we could see all sorts of data about one site would be, you know, property ownership, kind of overhead shots and the surrounding adjacent areas, and then a street shot kind of showing the general area that we would like to put the improvements in, as well as contact information and other notes that we picked up on, or kind of insights that we had about the site. Then externally, and kind of later in the process, kind of the output of this design process was obviously the design documents, the engineering designs, and that went through several levels of review, including, you know, going back to the city traffic engineer, and then, you know, some other stakeholders. At times, it would involve going back to the adjacent property owner, just if there was changes beyond what we had discussed. Things that we have found important that might not be initially obvious to folks who haven't participated in these sort of processes was just being that we are an agency that's separate from our city. We don't have direct interaction all the time with our city. contacts. So getting involved with our city traffic engineer and getting to know them on a basis where they'll give you time to review stuff together or to work together, because obviously that those individuals have a lot on their plate already. Working with the development and planning staffs within your city or community. And this is not so much on reviewing our own documents, but getting into their planning process, which I'll mention later. And then obviously, in our case, we had grants, and so we were interacting with the KDOT staff and the FTA staff. Yeah, and then further down, just beyond the development and planning staff, the folks who are doing other projects in the right of way. So like the utility, in our case, the water utility is not under public works. So getting to know those folks and anyone else that you might have interactions with, because you're going to have overlap or perhaps conflict in kind of resolving, fixing things or them developing things in coordination with where your stuff's at. And then, so I mentioned integrating into if you're not part of the city, integrating into that process, the site development process when they redevelop a building, like the image shown here was next to an Aldi's that they built. Obviously, you have to figure out what your local zoning guidelines or the expectations are of an entity building a new building. But in our case, the city typically, if we have a transit line adjacent to it, they require the entity to help in the construction of a pad if it's not already there. Also working with neighborhoods on different neighborhood level grants. In our case, we had the SWORD grant, and then also coordinating with Parks and Rec, because there's many facilities that we find that are along the arterials that we're already serving that are park sites. And so that has a little bit of complication, but there's, obviously shared public service to the community. And so a lot of times if you can establish that relationship, you can accomplish a lot together. And then finally, understanding some of the city's documents and expectations, like I mentioned, having something that establishes the ability to have new buildings or renovating buildings, have them be expected to assist in the construction of a bus stop, but also understanding what documents your city has adopted as far as ADA guidelines, and not only what they've adopted, but what their interpretations of that expectation are, because obviously 15 different people can interpret things such as the ADA guidelines 15 different ways. And so either learning where they're at, and then if you guys aren't quite enough on the same page, working to try to bring those understandings together. In our case, we've used some different resources with the with ADA folks on up the chain, and trying to kind of get more technical feedback on what the expectations are at a higher level beyond our city and our community. With that, kind of wrap it up, but just say that in our case, documentation as well as structure was a huge deal in documenting, keeping track of when we talked to people, what we talked about, and what their reactions were, so that as you move along, you can continue moving forward. Obviously, there'll be setbacks and inquiries, throughout the process, after the process, but we found it was hugely important to be able to have that stuff for reference. And yeah, just the last one, just knowing that I'm sure everyone on the call is familiar with this, but working in transit, not everyone's familiar with the transit needs or who rides transit or why it's important, and knowing that you're going to be somewhat of a transit equity warrior and getting out in the public and sharing the needs and the reasons why you're doing all this, because not everyone is as familiar with the benefits of transit as we are. So with that, I appreciate the time to share.
Thank you, Andy. And I know we had a couple of questions that were popping up in the chat. And so I'm going to actually start with the ones that were kind of to you, Andy. One person asked, stops, do you coordinate with Google Maps on GIS?
Yeah, we update those periodically. We probably should do it more often, but yeah, as we shift stops or they get new more specific locations, we go out and do a get the lat long on it and update it, and then periodically send kind of groupings of updates into our GIS stuff, as well as we have some AVL stuff so folks can track our buses. We try to update those things as well.
Great, thank you. And Anjali, I have a question for you as well. Can you give us a little more information? You mentioned the federal fund braiding in order to cover the local match. And as you mentioned, match is a big challenge, especially here in Missouri where state funding is pretty low. Do you have any more information, or where can people learn a little bit more about that federal fund braiding?
Yes, I do have some more information. As I explained, if you go to our site, we have a whole bunch of information on that, and also the cost sharing document that Mallory is going to post on the MPT site, because it is a lot of information that I don't want to take up too much time. But basically, the bottom line is that it allows you to use match from a lot of grants. So for example, when a lot of agencies would apply, say, for the 5310 funds through MoDOT or through KDOT, right? And they have to have the match, which is 50-50. But they also may receive funds through federal funds through DHSS, through the Department of Mental Health, through a whole list of other organizations. And so they are able to use those funds as a match. And some organizations do not realize that, and they're struggling, and I know some are like, they have a fundraiser. They've had some that would have, foundation dinners, all sorts of things in order to match, but they are able to use those funds. And so I think it's just making sure that they are aware of that, and I'll actually pop a document in here, a link here. And this one's a little more condensed. Here we go. Can you see that? I just put a document also in the chat.
Popped up in chat.
Yeah.
So that is another document that mobility managers or different organizations, directors, or whoever is coordinating their transportation can read through in detail that helps groups understand how the federal funding braiding works.
And Mike, if I could
Thanks.
add on to Anjali, when you guys look at the document, it is massive, but don't be afraid. The charts in the back of the document make it super easy to.
Yes, Mike, and this one right here is a little bit better.
Okay.
It's only 22 pages. So I did decide to put that one on there. It kind of talks about how it was developed. It talks about the funding braiding determinations kind of by the programs and things like that. So this may be a little more helpful. But yeah, the other document is pretty big. So it does take time to review.
Yes.
All right, well, thanks. And we will definitely be sharing the information out with all the attendees on the call today so that they can get the information. That just was something that I definitely found very interesting. I guess a question for Mike. You talked a lot about how the 5310 rule providers, came together with those in need of the NEMT services. Was that just kind of can you give me a little more about how that came together? Was it just a grassroots effort that made that happen? It was.
Yeah, well, it started with me calling Osage County, but in Kansas, we're very lucky to have an interactive map as a resource for all the mobility managers. And so I was able to just pull up a map and click on the collar counties, and then I would just call the agencies that provided that kind of transportation. So I was kind of preloaded with good information, and then it just came down to calling to see which ones were open during COVID and which ones had closed. So yeah, a little grassroots, maybe 2 hours of my time, but it was worth it.
That's great. Well, yeah, I know that's something that that we've been working on here in Missouri is trying to find some better ways to connect our rural transit providers with those individuals who need the NEMT services in order to better maximize some cost sharing.
Mike, if I could, I also
Sure.
have put another document in the chat, that the one that I did reference that is helpful, even though I know you'll add it, but if anyone wants to look at it right away, it's the cost sharing and cross partnership funding models. It's about 20 pages and it breaks things down a little bit more to kind of give various organizations a way to cost share. So, but we would be happy to do more detailed also presentation on that a little bit later, but that would probably take way more time. So
no, that's great. In fact, that was the next question that I had written down was how can providers get more information on the cost sharing to find out how to get more involved. So it sounds like that document is a great place to start, and going from that conversation, they can build off of that. Is that correct?
yes, for
Okay.
sure.
All right, and I apologize. Unfortunately, my desktop has been down all morning, and I've been having to try and operate the webinar from my phone, which is not ideal. So I'm trying to click back and forth between chat and whatnot. Mallory, is there any other questions in the chat box or the Q&A that I'm missing?
Let me take a look, but I did have a follow-up for Anjali about I know we talked about the federal funds matching federal funds, and as you said, we have almost no state funding in Missouri, but we're optimistic because the governor may be looking at changing that a little bit. But it's one of those things where staying realistic, but also still optimistic. In the past, when we've had federal furloughs, we've had a lot of providers have to cut back, if not reduce, if not stop service, because of our incredible dependence on federal funding. And so I would ask, in the state of Missouri, if that sort of situation were to happen, what kind of reliance, or what kind of impact would an increase in state funding have on these programs? I mean, how impactful would that be?
Well, as you know, that when there was a federal shutdown, and of course there were furloughs that have already happened, so that's happened already, and there was a huge impact that service had to be cut back. It made national news, and there was a lot of discussion about that. However, that is one reason why it is very, very important, especially within the state of Missouri, for more coordination to happen and for there to be a network. A lot of states that had a better network or a coordinated statewide plan for mobility management, they had to do some cutbacks, but the impact was not so severe. And so I believe that if, and I like to be optimistic that I think that we can get to that, because as we see that there are various pockets in the state, I think Lewis Lowry's on here in Kansas City, they have done a great job regionalizing that network. And I've kind of watched that as it, has built up to what it is now. That, yes, I know they had to cut back and make changes on routes, but the impact was not so severe. They're still able to provide service, and they're able to provide fair, free service. So looking at the rest of the state, I think that the main points is that better coordination, cross, partnerships and cost sharing would reduce that impact greatly.
I think that's really helpful. So sharing the
Can I add one
cost
thing?
also helps sharing that stain. Yeah, Chad, please.
I just like to add, in the rural areas, more money for transit. We have been pushing for that through our transportation groups as a planning partner with MoDOT. Even 10 to 20% would add more frequency of those trips. Some of these towns get a bus or a vehicle once a month, and there's not enough money for rural transit to connect them as well to some of those rural areas, to connect them with the urban areas. But it would have to be designated, not just we'll spend more on transportation. We have to really dive into some of those details. And I think the Transportation Task Force can help with that.
And I have a question, Mallory, for well, probably go to Chad and even any of the speakers. How were you able to conduct outreach and raise awareness, just trying to get out there to organizations and communities about mobility management during COVID? I know a lot of people stopped doing a lot of activities or said they weren't able to, but how are you able to change and adapt to keep that work going?
I can jump in for one example. I know that we contacted the public transit agencies and asked who was still providing service, who had cut back service, and put out a flyer. It's kind of like a stoplight, green and red and yellow for those that were still in service. And many public transit providers were still running routes. May have just been social distancing, masking, things like that were requirements. But I know during our campaign, a lot of people were afraid, even though they were open, was it safe to go on the bus? And so we really looked at, yes, it was safe. The precautions were being taken, but getting that message out, I think kept a lot of people out as well.
Just briefly, I mean, we went fare free in order to try and reduce interactions with folks. And as far as outreach, I mean, we've had several different instances where we discuss potential service reductions, one being the last couple of weeks, and we've just tried to distance in that way and provide multiple opportunities for folks to come so that we're not all there at one time. But we've run 100% of our normal service up until this point, and now we're facing operator shortages. So we're looking at potential cuts in order to try to right size our service with the number of operators we currently have.
And I'd add, just to support the whole thing, I tapped into some personal connections to try and get PPE, hand sanitizers, et cetera, the visors and whatnot to the drivers in my area to increase their safety as well as safety of the riders. And also I've been leaning pretty hard on email distribution lists. I send out a newsletter every Monday. And so that I know, even if an agency is not providing transit for whatever reason, at least they're getting updates on a regular basis of things that are happening with the feds, with guidance, with masks, but also with the state, with funding programs and things that are happening around the region that they should know about.
Yeah, thanks, Mike. And we did get a comment in the chat and from Stacy, and I will say that throughout Missouri, I know Andy just mentioned in Kansas, but yeah, throughout Missouri, operator shortage is a real challenge right now, right on the heels of COVID. As we're trying to get riders engaged in transit again, systems throughout the state have really been challenged and had to cut back services in multiple areas due to operator shortage. I don't know to Stacy's question, she asked if anyone has done a survey of operators to see what challenges they have and how we can best reduce operator turnover. And I don't know if the people on the call are able to answer that, but that's definitely something that we need to look at. And I know we're a little over time now, so do you all have remarks, or otherwise
I just shared that in our service, we're seeing a lot of experienced drivers taking maybe a more early retirement, and so that kind of creates a gap of people. And then in addition, I don't know that we've heard this specifically from respondents to our openings, but we perceive that perhaps there's a challenge that's further given industries like Amazon and other kind of driver focused industries popping up and becoming more popular through COVID and the like. And so it definitely gives more options for folks who might be interested in driving as a large part of their job.
No, I think you're right. I think that from anecdotal stories that we have here in Missouri. It's more competition for drivers based on driver pay, and a lot of drivers, especially in the 5310, 5311 in the rural areas, it was a second career. It was someone who came into driving in their 50s or 60s, and they were doing it for some additional income. When COVID hit, just due to the concerns that they had, there were a lot more drivers who were who wanted to step away from that because they no longer felt comfortable driving, and they were already at retirement age. So there was a lot of second retirements, if you will. So, all right. Well, with that, I'm going to go ahead and close this out for the day. Thank you all for presenting. I know I learned a lot, and I think everyone else did too. We will be sharing the slides and all of the information that was put in the chat today with everyone who is on. I also want to just give you a little information, some upcoming events that MPTA has scheduled. On March 2nd, we're hosting a vendor spotlight with Luminator, AMF, and Integrated Transportation Resources, where you can learn a little more information about their services and products that they provide. On July 8th, we're going to be holding our next Education Series event, which is going to be a presentation from Lockmuller Group on the results of Missouri's statewide transit needs assessment. And hopefully a lot of that information will be able to assist with these challenges that we've been talking with today. And then finally in September, on September 28th and 29th, we will be hosting our statewide conference and vendor expo in Springfield, Missouri. We hope many of you can join us there. More information on all of these events is available on our website. Please consider joining MPTA if you're not an official member. If you're a vendor, consider sponsoring our next MPTA Educational Series event or the upcoming conference. We hope to see you all again in the next couple months. Have a great day.
Thank you.
Thank you.